Jai Hind. Ahmedabad Hospitals and Nursing Home Association has announced suspension of cashless services from three major healthcare insurance firms, which are Star Healthcare Insurance, Care Health Insurance, and Tata AIG. Let's see what association has said about it. So according to association, the suspension will be effective from 2nd April 2025 till indefinite period. They have also mentioned that the decision follows long-standing dispute between hospitals and insurer companies, accusing the insurers for unjustified claim deduction, arbitrary claim rejection, and unexplained delisting of the hospitals from the network. The association has also mentioned on the behalf of hospital that insurers are involved in unfair practices. We have gone through multiple discussions which failed to resolve the issue. There are several incidents in which even after granting the pre-authorization for cashless, there is a significant difference in amount the insurers are sanctioning at the time of discharge. And this is really a very difficult issue to inform patients at the time of discharge. Let's see what insurance companies are stating about this. So according to insurance companies, the hospitals are pressurizing insurance companies for accepting higher tariff. And also, this is a unilateral call for multiple hospitals. Insurers have also mentioned that we have IRDA which regulates our department, whereas in hospital, there is no such body which regulate the hospital practice. They have also mentioned that we have blacklisted many hospitals of Ahmedabad Association. How it is going to end. So at the end, the customer is going to face the heat as they have already paid a premium for services, but they will not be able to avail these cashless services in multiple hospitals of Ahmedabad. So this is not a single issue. Recently, in fact, Max has stopped serving patients from care insurance. So let's see how can we make customer life easy. As government plays a major role in regulating any industry, healthcare now needs the government support. First is about price ceiling. The government should put a price ceiling on procedures so that it doesn't vary hospital to hospital. At present, for a single procedure, every hospital has its own tariff list. But I do believe that all the hospitals cannot be on the same place, and so we cannot have one single price for it. But certainly, we can have a price range for different categories of hospital and which can be categorized based on service they provide and infrastructure facility they have in, and there can be range of fee they can charge. A uniform rational guideline for clinical procedures to be adhered, which is certainly very much needed. Government should also trace the clinical treatment provided by the hospital and control the use of higher end antibiotics or medicines. Yes, we all know that price ceiling of medicine has been implemented by government, but still there is a huge range of medications which fall out of this list, and that really inflate the hospital bill. The suggestion, we could at least 95% of the medication into the price ceiling list, and which should definitely include all the drugs of non-communicable diseases. Let's see how IRDA can regulate this. So IRDA can check about number of reimbursement case any insurance companies is having, because majority of reimbursement happens due to non-empaneled hospital. So a lot of empanelment has to be encouraged. We should make sure that we have a huge network of hospital providing the cashless services, so that the patient doesn't face the issue of reimbursement and number of claims which are rejected. So certainly the number of cases which are rejected has to be analyzed to know what are the reasons for rejection. The second is, so package cost for all the insurance company has to be same. So at present, if you see, so all insurance companies provide a different rate list to different hospitals, and any hospital doesn't have the same rate list. So that's it. So that is also a very serious issue. We have to have some uniformity. Yes, there is a grievance cell which handles complaint, but probably that has to be more informed so that People are encouraged, or they know whom to approach in case of failures, so that such thing doesn't come as an end result. So what insurance companies can do to ease the life of patient? Insurance company has to be approachable. The hospital always complains about the approachability issue in terms of having pre-auth till the approval at the time of discharge or empanelment. So, and approachability will certainly help to resolve these issues. Deviation from pre-auth, if significant, is very dangerous for patients and hospital both. There has to be case-specific discussion with the hospitals in terms of rejection or deductions. Expansion of the network is much needed because there are multiple hospitals which are not empaneled and patients face issue when they need services in emergency. So what hospital can do? So hospital is ultimately a place where all this is happening. So they have a certainly very big role to play in. They should follow and adhere the rational guideline issued by government and or association, whichever is relevant, and use of specific departments. They should adhere by ethical practices and should undergo case-specific discussion. Thank you so much for staying with us on the hospital update. I hope these suggestions will be very useful in terms of customer services. Still, if any one of you have any suggestion, do drop in the comment box and stay tuned with the hospital update.